Hi everybody. I'm sorry I can't be with you in person today, so I hope this presentation will do. I wanted to tell you about a massive open online course or MOOC that we developed in 2017 to provide faculty development to clinical and educational supervisors around the world.
From our previous experience with MOOCs and understanding the needs of our target group, all busy health professionals, we opted for a 3-week course with an expectation of about 3 hours of work required per week. We developed and launched the MOOC on the FutureLearn platform. In our original MOOC, feedback from learners told us that workplace-based assessment and providing feedback was a key learning need. So we developed a course around this need. The course was developed by a team of health professional educators who are all supervisors in their own professions and therefore understand the needs of the target group. We included a trainee in the group as a co-creator. Key features of our course are the strong theory-practice links, the variety of methods used, opportunities for interactions with the course content and each other, opportunities for reflective practice, and an end-of-course assessment. Here are some examples of steps that learners enjoyed in the course. We discussed workplace-based assessment from the supervisors and the supervisees' perspectives, especially making sure that expectations of the assessment were clear to both sides. After discussing models of giving feedback, we used films of feedback encounters for learners to apply their learning and rate these encounters, giving reasons for their scores. Learners enjoyed actively engaging with the course content. This map shows learners enrolled on the 10th run of the course, which concluded recently. We had over 1,000 learners from 106 countries. 35% of learners were from the UK, and of the remaining 65%, the largest number were from India, Nigeria, Australia, Pakistan, Egypt, and USA. This figure shows the age range of learners on this course. As you can see, the majority were 26 to 35-year-olds. This reflects the interest in getting trained on this topic among new health professionals, as well as the importance of refresher courses for senior health professionals. Learners on the course came from a range of professions, as you can see here. What they had in common was their role as educators or supervisors of health professions students, trainees, and junior staff. For this presentation, I have restricted the data to the 4 runs of this course in 2019. In this table, you can see that over the year, we had 2,871 joiners, of whom 71.5% started the course. Of these, around 64% were active learners and 25% were social learners. Active learners are those who mark at least one step as completed each week. Social learners are those who interact with other learners. By the end of the course, almost a quarter had completed at least half the course, and 16% had completed over 90% of the course. The column on the right shows the statistics for these measures as an average of all FutureLearn MOOCs. More learners start and finish our course as compared to the FutureLearn average. We believe this is because our course meets an identified learning need for continuing professional development among health professionals. Based on the completion rates, learner feedback, via the discussion boards and from the post-course surveys, we believe that our course met the identified learning needs of the target group. The course design suited the busy lives of health professionals, creating a virtual community of practice and facilitating interprofessional and social learning. Here is a piece of feedback from one of our learners on the course. The point being made here is that theory-practice linkage using scenarios and case studies gave them suggestions for how to apply this in practice without compromising patient care. Here is another piece of feedback from one of our learners on the course. It highlights the role of social and interprofessional learning when planning faculty development for health professionals. The opportunity for social and interprofessional learning made the course much more engaging and useful for our learners. So, the key messages from our work are: 1. Well-designed MOOCs can provide engaging faculty development without geographical boundaries. 2. Challenges for supervisors are broadly similar across the world and across health professions. 3. Interprofessional and social learning are highly valued in an international setting. If you would like to explore our clinical supervision courses, please go to FutureLearn.com in your web browser and search under the healthcare category of the healthcare and medicine courses, as you can see here. We have a set of 4 clinical supervision MOOCs which range from 2 to 3 weeks in length. This includes the one we have been looking at today. You might wish to explore these at a later date. If you have any questions, feel free to connect with me. Thank you.